Go ahead.
Hi everyone, my name is Shanivia, and today um, I'm I'm presenting my paper on challenges to accessing applied behavior analysis services. A little bit of background on the paper. Autism is a developmental disability, which is highlighted by differences in social communication and functional skills uh, when compared to neurotypical individuals. Now, ABA is a evidence-based practice, and it enhances socially significant behaviors by using individualized interventions. And ABA services and interventions can improve communication skills, social skills, and also your functional skills. And it can also promote autonomy, overall quality of life of autistic individuals. And it also helps create helps families create a safe and nurturing space for their children. Despite all the evidence that ABA is great, we see that autistic individuals and their families still struggle to have access to ABA services. And the purpose of this paper was to, review the existing literature on the, challenges accessing ABA services, and then to discuss the implications and the future steps to, avoid these or to help, make these challenges a little better. Let's talk about the method. So this is a narrative review, and I use databases like Google Scholar, ResearchGate, and the SUNY Empire Online Library to, find relevant articles. And there was an inclusion criteria and exclusion criteria that you could see on the poster, as well as the search terms I used to find my articles. I found 5 themes across all the papers I read. And the first theme was the diagnostic barrier. So autistic individuals from different minority groups had different experiences when accessing a diagnosis. And the racial minority groups like the Black community, as well as the Korean community, and the Latino and the Hispanic community had a harder time accessing a diagnosis. Studies show that Latino families and the Black community had to fight for and advocate for a diagnosis way more than the white community. And they also the behaviors of their children were blamed on their culture as well as their socioeconomic status. And a study on the was conducted with the Korean families where I'm sorry, with the Korean families where they had a harder time communicating with their ABA providers due to a language barrier, as well as diagnostic providers, because they are they are because of the fluency in English. The next barrier is racial, cultural, and linguistic barrier. In this section, basically, we saw that Black families had and their children were proportionally left out of research, as well as they had delay in access with practitioners, as well as I'm sorry, I'm just blanking out. Could I have 1 minute? Sorry.
You're doing fabulous. Yeah.
Is everything okay, Geneva?
Yes, I'm okay. So Black children often experienced a delay in diagnosis with practitioners, and they often the parents were accused of lying about their symptoms or blaming it on their socioeconomic status. Now, Black families also experience delays in services because of the poor community resources and their inability to access higher quality programs because of the distance they lived in. Because again, race as well as geographical barriers, they're intersectional. Another study reviewed that the primary cultural obstacles were language, communication difficulties, and financial constraints, as well as cultural stigmas when it comes to disabilities. The next theme was socioeconomic status and geographical barriers. So a survey was conducted to assess behavioral service use in rural and non-rural communities. The results showed that both the groups reported having the same amount of services, but the rural families reported that the recommended behavior services were not implemented. And another study found that counties with lower socioeconomic status had fewer BCBAs when compared to those in the cities or urban areas. Autistic individuals who live in rural communities typically have delays in screening as well as diagnosis and fewer interventions. Now, the next barrier was state and public policies on age cap and insurance coverage. So the states that mandate insurance companies to include autism in their covered health conditions are legally allowed to implement an age cap, and the age cap is usually between 5 to 21. So once an individual reaches is an adult, they kind of do not have services, and autistic adults often have advocated that they do not have support services, and individuals with public insurance obtained more autism support services when compared to those with private insurances. And some families transitioned their children from private insurances to public insurances to have access to these interventions. The last theme was the foster care system. So a study identified that foster care has significantly more prevalent rates of developmental delay when compared to children in the general population. Over 30% of agencies have no policies for assessment of mental or developmental health for children entering their system. And this has a significant impact on the type of care these children will receive, right? And even with a referral, foster care children are less likely to have a proper diagnosis or mental and developmental health disorders. Another study stated that trauma symptoms resemble the behaviors associated with autism, and many individuals go undiagnosed or or misdiagnosed in the foster care system. So let's talk about the conclusion. So the barriers to accessing ABA services, it is multifaceted, right? It's not just one barrier. There's so many ways and everything is interconnected. Now, the barriers cause a significant delay when accessing ABA services. And if these barriers did not exist, each autistic individual would, be more likely to have the support services. Additionally, autistic adults and the racial minorities were more likely to have delayed and missed diagnosis. And this was mainly due to the lack of understanding about autism among the diagnostic providers. Systemic racism, linguistic misunderstandings, and lack of cultural sensitive services also hinder the access to ABA services. So if our ABA providers if they've had bad experiences with ABA providers, they are less likely to access these services. So it is very important that we, when interventions are created, they are culturally and linguistically sound. Again, rural areas had limited access to BCBAs, which meant that they had to travel longer distances, and the travel time was one factor. Also, the travel time was traveling is expensive, and also there were lack of resources locally. And state and insurance policies had an age cap. Again, once they are 21, they do not have access to ABA services. This study also serves as a call for action. So there is a need for policy change that supports easier access to diagnosis and ABA services for all age groups. Now, since we've already discussed that ABA is effective for everyone, although it is still marketed as a treatment for.
So that is our 10 minutes. I apologize. You did a great job. This was very interesting information. I hate to cut you off like that, but I just want to see, is Nathan in the room? All right, so next up would be Brianna. Are you ready to go?
Yes, I'm ready. I'm going to share my screen and my poster.
And again, I'm gonna have a timer and you all heard the sound, so.
Okay. All right, I'm all set.
All right, I'll start the timer and then take it away. Go ahead.
Okay. Thanks. So this was my qualitative research study on assessing the perspectives of migrant workers on food insecurity and health disparities during their time at work in the United States. So going over the background, we do have approximately 25,000 migrant workers living in the Finger Lakes region. So upstate New York area, for those who are not familiar. And in the Finger Lakes, I did have to use the data based on the region as a whole because there is very limited data on the migrant worker population right now. So there's a total of 11.2% of families living in poverty, with 10.7% suffering from food insecurity. Food insecurity has been known to increase rates of depression, and the migrant worker population is also at a greater risk of facing occupational injuries and illnesses, and facing language barriers and other barriers due to their legal status and finances. Workers also often experience social isolation, discrimination, and cultural adjustments and challenges that impact their mental health. And then it's also a common stereotype right now that migrant workers, we often assume that they are men, but most of them are women of childbearing age as well. And the main objective of this study was to assess the perspectives of migrant workers on their experiences with health disparities and food insecurity while living in the central New York area. And the study aimed to uncover potential challenges that they faced surrounding their access to healthcare and food resources. So for the methods, the study did utilize convenient sampling via social media to find study participants and used a guided interview as the data collection method. Interviews were audio recorded and transcribed for a thematic analysis. We also offered translation services just to reduce the chance for misinterpretation from the language barriers. And then following the interviews, the participants' responses were then grouped into themes based on positive and/or negative experiences. So table 1 showcases the participant demographics. 100% of the population was from Mexico, and at the time they were all former migrant workers who at the time of the interview had now become United States citizens and are here full time. During their time of work, they did have no access to primary care physicians. The males who I interviewed did have a few hospital visits that were solely related to work injuries and were covered through worker compensation. So there was no need for financial expenses out of their own pocket. So when it comes to the key results and findings of the study, none of the workers that I interviewed actually felt as though they were treated poorly, and they all obtained their work through legal means by working with the Mexican Embassy and the United States Embassy to receive their work assignments. Those work assignments also came with housing. And the housing was not entirely free. However, they were not able to provide an exact cost because it was a payroll deduction right out of their wages. Along with that, none of the participants truly felt that they were food insecure at the time. In fact, a few actually noted that they feel more food insecure now in these times as a United States citizen than they did as migrant workers. but they actually developed a community amongst themselves to be able to coordinate meals and ingredients to make sure that no one was overspending on their food and resources. So I thought that that was actually really nice. In a sense, they developed a community within their own workforce. However, they did highlight that there was absolutely no access to transportation, and within their work assignments, there were no individuals within their workforce that actually spoke English, and only the migrant workers spoke Spanish, and a lot of their training for their job assignments was visual demonstration. So they were not able to communicate with their higher ups to figure out ways to even call a cab to access transportation to get to grocery stores. And one participant did note that it was about an 8-mile walk just to the store. So 16 miles there and back with groceries can be a lot. And then when it comes to healthcare, there were no primary care services available. However, there were emergency services available that they were made aware of through work-related injuries only. And there was only workers' compensation coverage. They were not made aware of any other health insurance or healthcare services that they may have been made available to. And then a participant noted that if there were ways of them accessing primary care or other services, they were not made aware. Going into the conclusion, based on the analysis from the data, we can see that there were some differences between workers who did obtain work illegally versus those who obtained work legally in the country. So some of my participants, while they all did obtain work legally, they did note that they did hear experiences when they would get back to their home country in Mexico from those who did not have legal work in the United States, and they described them as very poor experiences. But based on the interviews with them, it did really highlight a need for community engagement within our migrant worker population. They do provide very essential resources and services for us as a population. You know, they provide us with a lot of our goods that we see in the supermarkets, a lot of parts that are needed to create lots of technology that we use day to day. And there are a lot of resources that we have that are readily available to them. And if they were just provided with the education and made aware when they are here, they would be able to utilize that and feel more connected to their overall community. And then furthermore, I feel like going into future research, it does highlight a point of being able to understand perspectives from individuals who do maintain work here illegally by illegal means, and letting them know the resources that are actually available to them if they do obtain work through legal means, and then also letting our workers who are here day to day know that they do have access to healthcare, they have access to education and childcare for their children, they do have access to like SNAP benefits. So there is a lot available to them. I think that we just need to provide more education and make sure that we're really engaging with those underrepresented communities. And thank you. That is all.
Great, thank you.
Well,
Cancel that out. Great job. So I see that we had a few more people that had joined us. Our next presenter is Christy Ann. Christy Ann, I see you're in the room. Are you able to hear me?
Yes.
All right, if you could, do you have your presentation ready?
Yes, just a moment.
Recording has started, timer has started, so take it away.
Okay, hello everybody. My name is Xun Huan. I'm a PhD student in geography at the University at Buffalo. Today, I'm very happy to introduce my my recent research on the Chinese target poverty alleviation strategy. And the title of my presentation is Assess the Social, Economic, and Environmental Impacts of China's Targeted Poverty Alleviation Strategy through the lens of system coping. Before I introduce my results, I want to give you some background about my research. Nowadays, the developing countries are facing dual challenges of poverty and environmental degradation, like the Africa, South America, and Southeast Asia. Those regions are all hotspots of both poverty of both poor populations and forest losses in the world. So it still remains a grand challenge for these developing countries to deal with these dual challenges. In response to the dual challenges of poverty and environmental degradation, the Chinese government launched the Targeted Poverty Alleviation Strategy, the TPS strategy, which aims to eradicate its rural extreme poverty by 2020. This TPS strategy has three features. The first one is precision. The TPS, which means the TPS strategy trying to identify the poor people precisely and use tailored policies to help them get rid of poverty. The second one is comprehensiveness. That means the Chinese government is using a combination of anti-poverty policies in health, education, and housing, as well as environmental restoration programs, trying to balance poverty reduction and environmental restoration. The third feature of TPS strategy is it is a typical state-led and top-down strategies in which the Chinese government designed the rules and implemented the TPS strategy. Also, the Chinese government spent a lot of money to help rural people get rid of poverty. So, however, from the academic literature, we know that bottom-up strategies for anti-poverty and environmental restoration are much more efficient and effective than top-down strategies. So my research question is that can China's TPS strategy truly achieve the balance of poverty reduction and environmental restoration? So to answer this question, I use a quantitative method. I use the drawing on the perspective of system coupling from environmental studies. I used the coupling coordination model to measure and quantify the complex interactions between three systems: the economical system, social system, and environmental systems. The first indicator of the coupling and coordination model is the coupling degree, which is used to measure the magnitude of the interactions between these systems. The second indicator is the coordination degree, which is used to measure the consistency between development trends between different systems. Like, are they coordinated development or are they disordered development? Here I'll show you some results. The first one is after measuring the overall performance of the three systems, the environmental system, social system, and environmental and economic system in the poor areas of China, I found that the three systems have divergent development trajectories during the implementation of the TPS strategy. Here in this figure, the blue line shows the dynamics of economic system in the poor areas of China during the implementation of the TPS strategy. And we can see that the economic systems have been developing rapidly. But for the social systems, which has different trajectories, here the orange line shows the dynamics of the social systems. At the first stage of the TPS strategy, the social systems remains the same, and it develops it develops gradually, while at the second half of the TPS strategy, the social system develops rapidly. But for the environment system, here the green line, we can see that the improvements in the environment system is small, and these improvements is unstable. So why the environmental improvements in the poor areas is unstable during the implementation of the TPS strategy? I analyzed the vegetation cover in the poor areas from the satellite images and analyzed this vegetation cover change during the implementation of the China's TPS strategy. And I found that the area of the vegetation covers, like trees or grasslands, is expanding in the poor areas of China during the implementation of the TPS strategy. But the quality of the vegetation cover has been decreased during the implementation of the TPS strategy. That means although the Chinese government is motivating some rural poor people to planted more trees or restore more grasslands in the poor areas, but these newly planted trees are small trees, or this species of the trees are just one or two or single species of trees. So the quality of the vegetation covers has been decreased. For the Köppen decrease, we can see that from this figure, the Köppen decrease has rapidly increased since the implementation of the TPS strategy. That means the implementation of the TPS strategy has promoted the interactions between these social, economic, and environmental systems. For the coordination degrees, I tried 3 different cases or scenarios to test the robustness of my results. And we may see that under different cases, these results remain are similar. So that means these results are robust. For the coordination degree, we can see that the TPS strategy, the implementation of the TPS strategy has increased the coordination degrees between the 3 systems. That means the implementation of the TPS strategy has transformed the socio-economic and environmental systems from uneven development or imbalanced development towards coordinated development. To understand this complex dynamics between these systems in the poor areas of China, I used the one of the anti-poverty programs from China, the Forest Ranger Program, the FRP program. In the FRP program, the Chinese government hired these rural poor people as forest rangers to patrol the mountains and preserve their local forests regularly. In return, these poor people will obtain a monthly salary of $110 per month. So which is higher than the global extreme poverty line by the United Nations. I have conducted a field work in a village in the southeast part of China to study the forest rangers and how they preserved the local forests, and I lived there for about over 3 months. And I found that these forest rangers are doing a very good job. They preserved this forest very well. However, I found that these forest rangers are highly dependent on the income from the Chinese government. So that raises a question: what if the Chinese government stop paying these forest rangers, or will they return to poverty if the Chinese government stop this program, or will they continue to preserve their local forests? So that's a question. So the sustainability of these socio-economic and environmental effects from the TPS strategy still need to be tested in the future. To conclude it, the implementation of a TPS strategies promoted this socio-economic environment in the poor areas, but the environmental systems was slightly improved, and this improvement was unstable. the socio-economic and environmental effects of the China's TPS strategy still need to be tested in the future, and China needs to persist its environmental restoration efforts in the PSA. These are my results. Thank you for your listening.
Thank you very much. Appreciate it. So, Christiane, you want to try this again?
Yes. I'm very sorry.
That's okay. Things happen. Just go ahead and try to do your screen share again.
On Hart and Risley's 1995 word gap study, and how it continues to be problematic and perpetuates racist curriculum. And I did mine in the form of a literature review. This is my poster, but I'll be going through a few slides throughout the next 10 minutes. So essentially, my literature review was based on a now highly controversial prominent study that was completed by Betty Hart and Todd Risley in 1995 that has now been informing curriculum and policy based on their findings that a 30 million word gap exists between upper and lower socioeconomic statuses. So this is the book, Meaningful Differences, that this is cited from. And just for the sake of knowing some background of the study, there was 4 groups that they looked at, made up of 42 families, 6 were welfare, 13 were low socioeconomic status, 10 were middle class, and 13 were high income. And those are using the terminology that they used. So all welfare families were people of color, and the majority of high income families were white. And then Hart and Risley spent an hour a month in each family's home over 2.5 years, which found that there was a 30 million word exposure disparity by the age of 3. So they're saying that these students had been exposed to 30 million more words than those in the lower class or lower socioeconomic status households. So I looked at several different references that were cited. It was a micro literature review. There was only 7 articles that I looked at, and the references were predominantly opposed to the Hart and Risley study or word gap theory, which I will use since it is not proven. And several have also been referenced in additional studies, or several also reference additional studies that have been done that have not been able to replicate the results of a 30 million word gap. My findings were that the intervention plans that are still in existence are marketed predominantly to low socioeconomic status families. They're not being marketed at all to upper class families. And that the foundation of academic success is built on merging linguistic and literacy patterns with those of the dominant culture. So looking at predominantly white westernized culture, making marginalized groups fit into those with how they speak in their language, which maintains the power dynamics of that culture. So they are trying to fix these identities rather than diversifying curriculum and language. I also looked at how early intervention programs promoted merging with middle-class linguistic practices, because throughout the Hart and Risley study, adult and child interactions were the only type privilege, child to child, even like sibling to sibling were not looked at all, which I think is a disservice to those families and to those children, because those interactions also lead to word acquisition. And families are taught how to communicate with their children with the sole goal being an increase in word count. So rather than looking at how they're communicating in the different ways, nonverbal or else like or otherwise that they're communicating with each other, it was only on word count. That was the only thing. So there was no depth to what was being said to the kids that was being measured through the study. The other thing that I looked at was how school curricula are designed to teach the dominant culture, which again kind of goes off the rest of them. And I want to leave this quote in here that says, children who fail to learn certain vocabulary designated by an institution that creates its own agenda and evaluates itself are deemed to have brought that failure with them in the form of unpreparedness. So what that's basically saying is that the vocabulary that is being pushed is designed by a racist institution and has its own agenda, which is why these families are being seen as falling through the cracks. So the way standardized testing works, as we know, is that it's a question-based model. There's a predetermined answer, and it's not very open-ended at all with what people are thinking or the opinions that they're bringing to the table. And that is what was privileged throughout the Hart and Risley study, as well as increasing questions like asking your kids, what color is this? Or what does the cow say? Which there's nothing inherently wrong with those questions, but how else are people communicating with open-ended questions and increasing creativity that way. And then the other thing that is not considered is that across global communities, linguistic features are multifaceted, and that's not represented. Like I said, it's very verbal based. There's not the nonverbal or other ways of interacting that can still be seen as valid that are referenced here. It was all word count. So the implications of the study is one, that the 30 million word gap is referenced as a prevalent statistic. It's utilized to inform literacy practices and programs in schools, such as reading intervention programs. And then unfortunately, because of the way this has impacted, students from a lower socioeconomic status are disproportionately represented. According to Google Scholar, this word gap theory has been cited over 12,000 times, showing the major impact it's had. It was cited by Barack Obama in a push for trying to bridge the gap, as they say. And the book became one of the best sellers in the history of that academic publisher, just to give you kind of a brief look into how much of an impact this has had. So the reason I think it's had such a major impact is because it is changing how parents speak to their kids. And that seems like something we can do to move the needle to, oh, look, we can see a positive change with that. And it seems like an achievable action step, but it doesn't really cost anything to do that. Or at least it costs a lot less than changing systems. So instead of looking at broken systems like providing families with housing or food or healthcare and other basic human needs, it's assigning family or blame to families trying to improve how they communicate with their children in a very blanketed format, rather than looking at, again, their own identity and the way that they're choosing to speak to their to their children. Additionally, through the articles that I looked at and several others, the study has been widely discredited by scholars due to the inherent flaws with the way the study was performed. So the fact that it was such a small sample size, it was only 42 families. Looking at the race across it, how the majority of the lower socioeconomic status families who participating were people of color, and how that may have impacted them because Hart and Risley were coming into their homes, they were sitting there, and how it might feel to have a white individual sitting in your home watching, and how that could impact how you're communicating with your family. So it might not be accurate in that sense. And then how when you're looking at higher socioeconomic statuses, when they're having someone who looks like them potentially coming into their home, or they're already prepared to speak more because it's something they're more used to because of the way culture works, that could have really impacted the way their data were collected. And so that's why a lot of people have debunked it, but even with it being debunked as a whole, it's still influencing policy. And then the non-inclusive language of using a gap instead of talking about the actual issues, and that deficit language and how that perpetuates racism that's being experienced throughout here. So in conclusion, looking at this, okay. Rather than looking at lower socioeconomic forms of communication as a deficit that needs to be fixed, that needs to be rectified, policymakers need to look instead how education can be aligned to address the needs of the diverse students who are coming through their doors and coming from multiple cultural backgrounds. And then drawing a correlation between a child's experience with language and their academic challenges, Hart and Risley failed to acknowledge the school inadequacies, like we said, standardized testing, etc., student strengths across diverse linguistic repertoires, and using those embedding those in lessons, which results in missed opportunities to help students scaffold their strengths and master skills expected in academic context. So the question that needs to be asked is, how are these strengths being pushed or asked to be put away, and instead, again, aligned with the dominant middle upper classes? How are people being asked to change, and how can those strengths be embedded into curriculum and also taught across the board so that we have a more well-rounded ability to communicate within our students? And then those are the references I used if you were interested in checking any of them out. Yeah.
Great job. Thank you so much.
Thank you. Thanks for bearing with my technical difficulties.
That's okay. Things happen.